We are united by a common dream, the pursuit of global health equity. This dream is not just our own. It is enshrined in the UN Declaration of Human Rights, in the founding principles of the World Health Organization, in the World Economic Forum's commitment to closing health equity gaps. If we share this noble aspiration, we must commit to the highest ambition of action. The learning from this fellowship has refined our commitment to that action. This fellowship has taught us how to leverage our privilege for the benefit of those we serve, how to use our power to achieve our shared purpose. As Odur tirelessly campaigns for legislative change, often at personal cost. As a mother of a child who was once very ill, I've learned profound lessons that resonate in hospital wards and parents' hearts worldwide. I will never forget the terror I felt when I realized as a physician and as a mother how sick my child was. The fear I felt when my concerns were dismissed by the on-call doctor. Yet amidst that turmoil, the acts of kindness from hospital staff and fellow parents stood out. A gentle touch, a reassuring smile, a cup of tea in the small hours. During that time, the news was filled with reports of nurses relying on food banks to feed their families. And I vividly recall a nurse, worn down, yet still caring, taking a break in a threadbare hoodie, clutching a Tupperware of leftovers. And I realized her kindness came at a personal cost. And this experience taught me a crucial truth. Our healthcare systems cannot rely on a few people being kind a few times. Kindness must be systematic. Unconditional regard must be systematic. I am Irish. I work in the National Healthcare Inequalities Improvement Team in England. And for the last few years, I have joined others in shaping national policies and frameworks to address health equity gaps, trying to build gold standard aspirations into policies that are person-centered, to emulate how Jan tirelessly picks herself up to drive forward policy change for good. I am part of a team including people with lived experience, healthcare workers, policymakers, charity workers, who built a national framework for supporting people experiencing homelessness attending emergency departments. We built into policy data collection, legal duties, person-centered care, and compassion. I support the Core 20+ ambassadors, a national network of over 250 professionals and clinicians working in the NHS to embed the national strategic priorities to improve inequalities for the 20% most deprived nationally and for the plus populations experiencing inequalities locally. I am proud of our results. And yet, every time I work a shift in my hospital, I feel uneasy. I feel I'm not doing enough to make these national frameworks a reality, to put policy into practice. I want to share another story of devastating parental heartbreak. The Health Services Safety Investigation Bureau in the NHS in England released a troubling report of the tragic death of a child from the Roma community. The child was referred for a brain scan, but due to misunderstandings, the family did not realize that the child had to fast for the scan. And after multiple cancellations and significant delay, an invasive brain cancer was diagnosed. Treatment was started, but sadly, the child died. It was too late. So the report concluded that the healthcare system failed to provide information in a way that the family could understand, highlighting a fundamental problem in communication and follow-up. In response, I am working with the head of patient safety and over 70 patient partners to develop a national commitment aimed at reducing patient safety inequalities, including better communication and interpretation for community languages. Kindness must be systematic. Unconditional regard must be systematic. However, we all know that system change is complex and messy. It requires us to embrace ambiguity, as Wolfgang Mahne taught us in Washington, D.C., but to also be intentional and inclusive, as Rachel has shown us in her careful, distributed leadership. The hospital where I work is a busy urban facility in a multicultural, multilingual city in England, where English is not the preferred language for about a quarter of the population. My project during this fellowship illustrated the need for systemic change. And the story of the little Roma child was not unfamiliar to me. I recall countless times struggling to find an interpreter for patients who did not speak English. I remember a person in severe alcohol withdrawal, their anxiety growing as we fumbled to find a phone to reach someone who could speak their language. I witnessed well-meaning relatives trying to bridge the communication gap, yet feeling the shared frustration and shame as details were disclosed to families and friends that should have remained private. But from Hina's leadership in telemedicine and her painful experience of translating medical information as a child, I know we can do better. From this fellowship, I've learned about leadership, that it is about enabling others to achieve a shared purpose in the face of uncertainty. This has shifted my understanding from a pragmatic, task-oriented approach to a distributed leadership and participative management. As Wilfred has shown us, sharing power with local leaders. As Mario has shown us, sharing his voice with senior corporate leaders. Our fellowship journey began in Washington, D.C., where we were trained by some of the best minds in the world. We learned how to know disparities, to combat inequity, to build leaders, and to create a network. I returned with enthusiasm, believing that if I shared it, change would follow. However, I quickly realized that enthusiasm alone is not power. Power is the ability to achieve shared purpose. I struggled to hit the right tone, the balance between urgency for action and generating hope. My pleas for respect and empathy often felt dismissed as soft stuff compared to clinical data. I had the right words, but I lacked the right tone. During our time in Rwanda, we saw the power of a shared narrative and the translation of commitment into action. The community healthcare workers exemplified how to fulfill health aspirations. And it was Professor Akiki who showed us how to embody that spirit of service. She taught me that true leadership requires authenticity, vulnerability. It requires us to be broken down and remodeled to serve our purpose. Returning from Rwanda, I understood that it wasn't enough to have the right words or the right tone. I had to draw on my authentic voice and recognize that I'm part of a global community of Atlantic Fellows. I am inspired by Jasmine, who uses her voice so thoughtfully to advocate for Indigenous health, by our Maori hosts, who demonstrated the strength of identity and community, to draw on the strength of our unity, our collective call to action. At the beginning of our fellowship, a group of dedicated clinicians in my organization surveyed their frustrations trying to communicate when English wasn't the preferred language. We expressed the need for a phone with reliable reception for interpretation services. Alongside this survey work, I engaged with senior hospital management, quality improvement leads, operations managers, data leads, public health experts. And slowly my initial concerns began to shape into a narrative, a story that could drive change. But I quickly realized that transforming this into a shared narrative, a collective purpose, was much more complicated than I had anticipated. I didn't have all the answers. I didn't know how to navigate the practical challenges of translating policy into action. And the people I spoke to as individuals didn't have the answers either. And I realized change doesn't come from the top down. Working directly with the healthcare workers who took the survey gave me the closest possible insight into the realities that I wanted to change. But I realized that we needed more than incremental change, more than individual kindness. We need transformative, systemic change. We need systematic kindness. And that was when I hit the point of discomfort. Maybe it was the productive zone of disequilibrium, but I couldn't see a clear way forward. I wasn't sure if this was the end point. I let go of control of the project. I let go of the direction of the project. And then I met a family whose elderly mother had to be admitted to hospital, and she didn't want to come in. She is terrified, her family told me. She can't understand anything without us, and we're not allowed to stay with her. She is afraid. And I wanted to approach this woman and communicate in her community language and reassure her that we would understand her, that she would understand us. I wanted to say, you can trust us. But I knew that was a promise I couldn't keep. The system wasn't set up to truly ensure that. And this experience reminded me, health inequalities are unfair, but they are avoidable. It doesn't have to be this way. I realized I was afraid of failing, afraid that our efforts might not make a difference. And I talked with my colleagues, and I discovered that they shared that fear. Fear of getting it wrong. Fear of using the wrong words, the wrong tone. Fear of misunderstanding. Fear of inadvertently singling people out, their cultures, their languages. Fear of creating anxiety in people who may be undocumented, in people who may be fearing deportation. And these fears were holding us back from translating policy recommendations into practice. The weight of these concerns, combined with the day-to-day pressures of our roles, made it harder to find solutions. But as we talked, we started to give voice to our fears. And that gave our work meaning. We realized that fear wasn't something any of us could own alone. It was collective, a shared challenge that we had to confront together. And so we decided to step into that discomfort. We recognized that fear was not a barrier, but a motivator. A collective drive to shape kinder, more inclusive systems. I'm proud to say that our request was met just last week. A phone is now available for all to use to access interpretation services. We'll survey again to measure its impact in terms of data, but there's a broader impact that can't be captured by numbers. Along with the phone, we received an email from the senior matron for emergency care, and he wrote, "Thank you for taking the time to raise this for our patients and for our staff. Anything else you think we can do, please let me know." This response is not about providing a phone. It symbolizes recognition of the challenges we face and a real commitment to action, a commitment to a shared purpose. It represents the transition from policy aspirations to tangible practice. It's about moving forward even when we stumble. It's about rebuilding the trust that families can place in us. It's about fostering communication and shared understanding. And this is just the beginning. We've set in motion the first of many inequality improvement projects. We've begun developing a dashboard to track equity improvements, establishing mechanisms for working together, and building cycles of improvement. But most importantly, this is about shared action and a collective commitment to our shared purpose. In the words of Prof. Akiki, we are broken, but we are connected. And out of these connections, when we draw on our very brokenness to build them, comes our strength. On a cold winter morning in Washington, D.C., we agreed to practice kindness, respect, empathy, honesty, presence, self-awareness. We committed to consistency, resilience, and the courage to show up as our full selves. And they have served us well this year. And yet, to me, they are more than an interpersonal commitment to one another. They are the stuff our systems, every single one of our systems, must also reflect. Kindness, respect, honesty, presence, self-awareness, consistency, resilience. I invite you, my friends, to reaffirm your values and commitments with me now. And to do so not only as commitments to one another, but to the work we have ahead. Work to build unconditional regard for others within our system. Systems that reflect our values, our commitments together. So to use an old Irish proverb that is often quoted by the President of Ireland, Michael D. Higgins, to epitomise active, inclusive, confident participation, aiming for equality and respect for all. Ní neart go cur le chéile. Please say this with me now in my native Irish language. Ní neart go cur le chéile. Ní neart go cur le chéile. Ní neart go cur le chéile. There is no strength without unity. Thank you.